Sarah, welcome back. I'm glad you're here today. Before we get started, I want to check in with you. How have things been since our last session?
It's been a mix. Some days feel manageable, but other days, especially mornings, I wake up already anxious. It's like my body is tense before I even open my eyes.
That sounds exhausting. Morning anxiety can feel overwhelming because it hits before you've had a chance to prepare yourself. When those moments happen, what do you notice first? Your thoughts, your breathing, or your body?
My body, definitely. My chest tightens, my stomach feels heavy, and then my mind starts racing.
That's a very common pattern. The body reacts first and the mind follows. I appreciate how clearly you're describing it. It helps us understand what's happening and how to intervene earlier. Last session, we talked about adding supportive tools to help you regulate those symptoms. One of the things we discussed was the possibility of bringing a pet into your life. I'd like to revisit that today. How are you feeling about that idea now?
I've been thinking about it a lot. I didn't want to rush into anything, but I think having a pet might help me feel less alone, especially during those anxious moments.
That's a thoughtful way to look at it. Emotional support animals aren't a cure, but they can provide comfort, grounding, and companionship. They help regulate the nervous system by offering a steady, calming presence.
I like that idea. I don't want to depend on people all the time, but having something warm and comforting nearby, that feels different.
hmm It is different. Animals don't judge, they don't rush you, and they don't expect you to explain what you're feeling. They respond to your emotional state naturally. That can be incredibly healing.
I think I'm ready to try. I want something that can help me feel calmer.
I'm glad you're open to it. We'll take this step slowly and intentionally. First, we'll talk about what type of animal might fit your lifestyle, your emotional needs, and your daily routines. We'll also discuss what it means to care for an ESA and how it becomes part of your treatment plan.
That sounds good. I don't want to make a mistake or choose something I can't handle.
That's a responsible way to approach it, and you won't be doing this alone. I'll guide you through the process. We'll look at temperament, energy level, and how the animal responds to human emotion. You'll have support every step of the way. Before we move forward, I want to talk about your anxiety patterns. You mentioned mornings are the hardest. Let's explore that a little more. What usually happens right after you wake up?
I sit on the edge of the bed and try to breathe, but sometimes it feels like the day is already too much. I don't know where to start.
That's a heavy way to begin the day. I want to teach you a grounding routine you can use as soon as you wake up. It's simple, but it helps your brain shift out of panic and into the present moment. It's called the 3 point reset. First, place your feet flat on the floor. Second, take one slow breath in and one slow breath out. Third, name one thing you're grateful for or one thing you're looking forward to, even if it's small.
I can try that. It sounds doable.
Good. And as we prepare to introduce an emotional support animal into your treatment plan, this grounding routine will help you notice how your body responds to comfort and safety. It will make the transition smoother.
Okay, I'll practice it this week.
For your homework, I want you to track two things. When your anxiety rises, for your homework, I want you to track two things. When your anxiety rises, time of day, what you were doing, what you felt, any moments when you wished you had support or comfort.
I can do that.
In our next session, we'll talk about the type of animal that might be the best fit for you. We'll also discuss how an ESA can support your daily routines. And if everything feels right, we'll take the next step toward introducing your emotional support animal. Now, Sarah, because you are currently living in an apartment community, I am going to need to provide you with a valid ESA letter so that you can live with your emotional support animal. This letter will also help you avoid a pet deposit and monthly pet fees.
I'm actually looking forward to that.
I'm glad. You're making thoughtful, meaningful progress, Sarah. I'm proud of the work you're doing. I'll see you next week.
Next session, Sara begins the ESA selection process.
The information provided in this video is for educational purposes only and is not a substitute for professional mental health evaluation, diagnosis, or treatment. CarehavenPets.org provides ESA/PSA assessments and PSA training services in accordance with federal and state guidelines. An emotional support animal, ESA, or psychiatric service animal, PSA, requires a clinical evaluation to determine eligibility. Watching this video does not establish a client-provider relationship, does not guarantee approval, and does not replace the intake or evaluation process required for an ESA/PSA letter. If you are experiencing a mental health emergency, please contact your local emergency services or a licensed mental health professional immediately.